Well, over in West Africa, Nigeria is dealing with a cholera epidemic. Since January, more than 31,000 people have been infected with the disease and over 800 have died. The death toll in 6 months is almost half the figure recorded so far for the COVID-19 pandemic, a disease the country has been combating for nearly 2 years. Correspondent Phil Ihaza tells us more from Nigeria's capital, Abuja.
65-year-old Conde Samuel has been diagnosed with cholera at this clinic on the outskirts of Abuja.
I've been having a terrible stomach pain for days now. It got worse and I started stooling and vomiting uncontrollably. That's why I rushed to the hospital and the doctor confirmed I have cholera.
Cholera is a disease that spreads in contaminated water or food and can lead to death if not properly treated. Several hospitals across Nigeria are being overwhelmed with a monthly average of over 5,000 cases of cholera recorded by Nigeria's Center for Disease Control. There have been more than 800 deaths since the start of the year.
If you check our bed capacity, we have about 20 bed capacities. But at a stage, we used to have up to 12 at a time. So only 8 of the bed you have for other ailments. In a day, you have like 10 patients just for this particular hospital. You just see them, their loved one going down, and they don't even understand what is really happening.
Cholera cases often occur in rural areas where there is lack of proper sanitation, hygiene, and many people cannot get safe drinking water. A non-governmental organization has gathered residents of one of such communities in Abuja as a way to help curb the spread.
We are here to conduct a door-to-door campaign to sensitize the residents of this community about the dangers of cholera, and at the same time to advocate for personal hygiene and environmental sanitation. So we are progressing and the people are cooperating, considering the fact that it is killing already and our hospitals are already saturated with cases of cholera.
The residents are taught how to keep their environment clean.
Nigeria is deploying huge resources to combat the pandemic, and this has taken a toll on its healthcare system. But with more efforts like this, particularly in rural areas, the aim is that the cholera epidemic can be defeated soon.
The Nigerian government is also partnering with organizations like UNICEF to promote chlorination of water among affected communities. And so far, about 4.5 million people in Borno, Adamawa and Yobe states in northern Nigeria have benefited from it. Officials hope these efforts will see fewer people needing hospital treatment like Conde. Phil Ihaza, CGTN, Abuja.
Community